With so much controversy surrounding COVID-19 treatments, what information is out there? What do you need to know? And why are people for or against certain treatments? Let's take a look today at carefully at a couple of treatments, hydroxychloroquine and Remdesivir. So stay tuned, and this is going to be a PNDA Pondering. So welcome to Friday, May 8th edition of PNDA Ponderings. This is Phil. I'm back at it again, giving you information that you should know about and ponder on. Today's topic is going to be COVID-19 treatments. A couple of weeks ago, I had a discussion in a previous PNDA Pondering about a few of the new treatment developments that were heading into clinical trials. And today I want to specifically talk about the controversy of one of them and highlight a little bit about the other one. Both of these are on the top of the list when it comes to what's going on in the world of treatments for COVID-19. So they are, as I said in the little teaser above, hydroxychloroquine, Azithromycin, and Remdesivir. I'm not going to use those names, I'm not going to try to pronounce them each and every time. I am horrible at pronouncing things. So the former one will be, I'll refer to it as HCQ-AZ, or HCQ-AZ from this point on. And Remdesivir, I'll just kind of continue talking about. So what's the controversy here? Let's start with HCQ-AZ. So there is a lot of kind of buzz going around with HCQ, and some of it's good, some of it's bad, and it really stems from this. There's a study performed at the IHU Militaire Infection in Marseille, France, by Professor Didier Raoult, in which he had over 1,000 patients, 1,061 patients to be exact, that were treated with a HCQ-AZ treatment. And what they found was 973 out of the 1,061 patients were cured within 10 days. That's a 91.7% cure rate. Now, 46 patients did observe a poor outcome. That's 4.3%. And of the 46, there were 10 that were transferred to ICU. There were 5 that had died. Those 5 were all between the ages of 74 and 95. And the other 31 just required another 10 days of hospitalization. So the thing is, when they started immediately after diagnosis, they found that it was safe and it produced a mortality rate less than 0.5% in elderly patients. It also avoids worsening, and it clears the virus persistence and contagiosity in most cases. What they also did was they followed this up through 9 days, and they investigated what was also the fear of cardiac toxicity. What they found was there was really no significant cardiac toxicity observed. The good thing about HCQ-AZ is that this is widely available in generic form. And so, for instance, the cost of HCQ-AZ is roughly about $20 per dose. With health insurance, this would make copays possibly around $4 to $5 per dose. And another thing that people don't know is HCQ has actually been approved decades ago. This is not a new drug. The FDA has approved this, and the approval date was April 18th, 1955. Yes, it is, over 50 years old. It's been in the market since 1976, and that's why there's so many generic forms that help bring the cost down. By the way, Remdesivir has not been FDA approved, and the only reason it was allowed to go into clinical trials was because Dr. Anthony Fauci called for the FDA to give an emergency use authorization for Remdesivir. What's interesting to note is that the authorization usage only came from data that the government themselves had a trial, and in that trial there was only merely a suggestion that this experimental drug of Remdesivir might help patients recover faster as compared to that of a placebo. There's no independent studies. There's no third-party, confirmation. They used data from themselves to prove what they wanted to show the FDA to get this pushed through. So going back to HCQ-AZ, this treatment can also be given orally, whereas remdesivir has to be given intravenously. And this means that the patient is already very sick, whereas like with HCQ-AZ, this can be administered without waiting until a patient is very sick. There are also other studies that they found. Dr. Vladimir Zelenko, who is a board-certified family practitioner in New York, has said in a video interview that HCQ-AZ, along with zinc sulfate, that combination, that cocktail, seems to be showing phenomenal results with over 900 coronavirus patients that he has been treating, as well as a Dr. Anthony Cardillo, who is an ER specialist and the CEO of Mend Urgent Care in California, has reported seeing symptom-free results within 8 to 12 hours after his patients have taken this combination. So those are some of the good things, but what are the cons? So first of all, there's concerns over the study itself, and I definitely want to point to that because y'all need to understand the ramifications of this. Dr. Raoult in France first did a study of this with only 42 patients, and that those were specific people that were chosen by Raoult about who would receive the drug and who would receive the placebo. That's a big no-no in clinical research. It must be randomized. And there are also concerns about a lack of peer review and possibly that the second study doesn't even have a control group at all. And so that's an issue. Like a control group helps to determine whether there are factors that are a part of the environment and part of the group that are bringing into effect for some of these results that are getting. Beyond just the study themselves, there was also another issue which stems from this group. So in the U.S., there is a panel of experts that have kind of come together that recommend against doctors using HCQ-AZ because of potential toxicities. Now, this group was, specifically chosen by our government, and there's a specific reason why they're talking about this. So they're talking about the combination of the hydroxychloroquine and the azithromycin, and the combination of the two creates what's called QTc prolongation in patients with COVID-19. First, you need to understand what is QTc prolongation. It basically, at the bottom line, it's just a indicator of an increase of a possible increase of sudden cardiac arrest. So this is a marker that helps doctors and other health professionals know, hey, someone is more at risk for some sort of heart or respiratory issue. By the way, several commonly used medical drugs are associated with QTc prolongation. This includes the antidepressants, antipsychotics, antimicrobials, antiarrhythmics, etc. These drugs are normal ones that you or anyone that has probably taken in some way, shape, or form, in their lives. But it's interesting that the drugs in these categories that are associated with QTc prolongation are still approved and used commonly by hundreds of millions of people around the world. Also, the data that they're looking at, by the way, suggests that any prolonged ventricular tachycardia or ventricular fibrillation are consistent with COVID-19 manifestations. What this means is there's no distinguishment between whether or not these patients were having breathing and heart issues due to COVID-19 or due to the treatment. They just were lumping all that in together. And at the end of the day, when forced into an official statement, they said that there was insufficient clinical data to recommend either for or against HCQ-AZ. Interestingly enough, the same conclusion unofficially. Interestingly enough, they came to the same conclusion unofficially on the drug Remdesivir, but they aren't really promoting that in the news with that information. And you kind of have to wonder why. One thing you also have to notice is that Dr. Anthony Fauci was not hesitant to declare remdesivir as a clear-cut positive winner or factor in helping to clear or cure COVID-19, regardless of this insufficient data. And yet he's willing to declare that HCQ-AZ as the clear-cut negative when both have equally insufficient data. I think you need to know about this panel that made this statement. See, this panel is made up of experts, and there's these experts, it's 50 different researchers and physicians. But there's a little problem here. So remdesivir is made and being produced by a company called Gilead Sciences. I don't know if you know this, but 8 out of those 50, so nearly 20% of this panel, are actually from Gilead Sciences. Now, a 9th member has disclosed financial ties to Gilead, and 7 other members failed to disclose but were found out that they do have financial ties to Gilead. And then several more members also have ties to Gilead that wouldn't necessarily require disclosure. So it's like some sort of a byproduct of some interaction or some work that they've done. Combined, this makes up the fact that the majority of this panel of 50 is connected to Gilead. So now that we're talking about remdesivir and the company Gilead, we should probably switch over to remdesivir itself and ask, why is it so touted? So again, Gilead is brought to you, remdesivir is brought to you by Gilead Science. It's a big pharma company that has a lot of government funding. Specifically, these clinical trials for remdesivir are actually government funded or government sponsored. I haven't been able to find any published results from Gilead's clinical trials. I've only seen verbal and anecdotal reports that remdesivir has a faster recovery rate compared to those who received a placebo, changing from 15 days to 11 days. Also, here's another interesting note. All these trials have to be registered by the U.S. government's online registry of clinical trials. Well, weeks before, remdesivir had a particular measurement that now all of a sudden has changed. So this is kind of like moving the goalposts. Because originally they were measuring the effectiveness against death, hospitalization, supplemental care, etc. And now they've changed it to just merely shortening the recovery time. This is a problem because when you're changing primary endpoint, when you already know the data of what the research is coming out to, this is known as research fraud. The best metaphor that you could use to describe this is, instead of shooting an arrow at a target, you shoot it and then you draw the target around where the arrow landed. By the way, remdesivir is also a boutique drug, meaning that it costs around $1,000 per dose. Even with insurance, this will cost the American people hundreds of dollars. And if it won't cost us directly this money, it will end up costing taxpayers this money. Another interesting thing to note is, once remdesivir was touted by Dr. Anthony Fauci, their stocks have risen. On January 31st of this year, their stock traded at $63.20. After the push from Dr. Fauci, the stock rose to $83.99 on April 17th. Just some facts that's there. Now, I'm not here to tout that one is better than the other, or that you should not trust remdesivir because it's made by big pharma, or that you should not trust HCQ, or you should trust. Look, equally, they are both untested enough, and we don't have enough information for any conclusion at this point. The problem I'm addressing is not whether or not these are being clinical tested and tried, and I think they all should be tried. We got to find the solution, right? That's not the problem. The problem is how the public perception is being kind of steered by some of the reports, stemming from what, I don't know. But there's a consistent and concerted effort to give misinformation to the negative on HCQ-AZ and misinformation on the positive on remdesivir. you need to ask why this is the case. So you got to be careful about the intake of your information. Again, I'm not advocating for HCQ-AZ. I'm also not advocating against Remdesivir. I'm pointing out that both are lacking data and information, and both are in very similar states of positive and negative effects. Yet one has gone viral with information about its positive nature, and other has gone viral with its negative nature. You're also seeing a lot of censorship happening on Facebook and YouTube and videos, and I wouldn't be surprised if my video gets censored on Facebook and YouTube. All I'm saying is that there's just a very concerted effort for a particular narrative to come out, and you need to decide who and why that narrative is coming out. Those are things that I'm going to leave with you to answer for yourselves. I just want to give you the information that's out there. Once again, I'm not saying Remdesivir is bad. I'm just saying they're both untested. Yet, the stories that are coming out are vastly different. And this is what you need to watch out. What is the news and the information you're getting, and how is it being formulated to give you a sense of the kind of feeling or narrative that they want you to know? And by they, I don't know who it is. I'm just saying that it's happening. So, once again, this is PNDA Ponderings with Phil, and I hope that this gives you something major to ponder about. Take care, be informed, and you have the choice and responsibility. Bye-bye.